Good morning and welcome. I'm Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Alex DeJesus. Dr. DeJesus is a rheumatologist. If you have any questions for Dr. DeJesus in the future, two ways to reach us. Get us through the foundation. That's www.needfoundation.org or fax 696-9012. I'd like to talk about something scary but necessary, and that's privatizing Social Security and Medicare. Sounds pretty scary, doesn't it, with the markets the way they are? But I contend, and I will argue, that privatization is the only way we're going to have a decent retirement and health care through Medicare. So let's look what's happening currently. Currently, for those of us that pay into Social Security and Medicare, which isn't everybody, some have opted out, we put 15% of our gross salary into the trust fund. This is based on before tax dollars. After taxes, it's equivalent to 20% of your net income into Social Security and Medicare. It's spent in the general budget. There's absolutely not one dime in the trust fund. There's that much money. And so to pay out the benefits, they have to tax the current worker, period. Tax the current worker. Remember that. So if we were to privatize it, that is, put it in a qualified retirement, things like we're required with 401, where they have to be qualified. You just can't throw it in oil wells. It has to be qualified. And privatize it, it has a chance to grow with the market. And believe me, the market's grown 9.2% per year since 1920, including the Depression. But let's look at the worst case scenario, because they're trying to scare you, saying you can't privatize it, look at the market's going to crash. Countries that have done this have guaranteed or backed up the privatized plan, saying if you don't make the money in the privatized plan, the government will pay for it like they would have anyway. And then your response is, but where's the money going to come from? And my answer to that, it's going to come from the same place it's coming from now anyway, which is taxation of the current worker. So at worst case scenario, you're still doing the same thing as if you didn't privatize it, but at least privatization gives you the chance to retire and have your health. Case in point, Galveston City employees privatized. Somebody puts in $50,000 a year in their privatized plan, will receive $6,200 a month when they retire, versus the Social Security recipient receives $1,500 a month. That's 4 times as much. Also, when the Galveston City employee dies, their family gets the money he saved. $350,000 comes out of their annuity to their family. What's the death benefit for Social Security? $800. You work 45 years and your family gets $800. Somebody worked from the age of 18 to 25 if it's privatized and they work for minimum wage, that's $2,000 a year they put in, would rack up to $1.08 million by the time they're 65 if they never work past the age of 25. That's the power of compounding. Federal government wants to scare you about privatizing. Why? Because they're taking the excess money and they're using it in the general budget and they're putting nothing in the trust fund but IOUs. You know what scares me more than privatizing? Is the fact that Social Security and Medicare for us baby boomers retiring is backed up right now by the same thing Fannie Mae was backed up with. The same thing. Promises. These are my opinions. If you have any comments, 2 ways to reach me. Do it through the foundation at www.needfoundation.org or fax 696-9012 to ask the doctor.
Hi, I'm James, and I play football again because of the Orthopedic Knee Foundation.
Hi, I'm Dr. Peter Holmes. Others like James could use your help. The Orthopedic Knee Foundation was formed to help those families without insurance or underinsurance. Every donation is important to get them back to their pre-injury level.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.